Hello students. Today's new topic is fracture of shaft of the femur.
Okay, sir.
Femur has a powerful group of muscle. Iliopsoas, which is a powerful flexor, is inserted into the lesser trochanter.
Gluteus medius and minimus, which powerfully abduct the hip, inserted in greater trochanter. The abductor longus, brevis and magnus, and inserted along the medial aspect of the shaft.
The gastrocnemius muscle origin are attached to the posterior aspect of the lower end of the shaft. The muscle aspect attachment causes the typical displacement of the fragments in fractures at the proximal, middle, distal thirds.
Proximal third. Fragment is small and is drawn into the flexed position by iliopsoas muscle, abducted position by the gluteus medius and minimus muscle. Middle third. Distal fragment is displaced medially and pulled upwards by the adductors overriding and outwards angulation.
Supracondylar level. Distal fragments is flexed by the origin of the gastrocnemius muscle. Injury to popliteal vessel. Classifications are symptoms of shock, swelling, tenderness, deformity, abnormal mobility, shortening of the limb, dorsalis pedis, posterior tibial artery polypated lead to ischemia, gangrenes of the leg.
Radiological features are antero-posterior lateral.
Management: splint, Thomas splint, safe transportation.
Treatments. Treatment for shock, to reduce refracture and maintain re-education till union, stiffness is prevented, maintain limb length.
Fracture of upper third, conservative, oblique fracture, early maintained by continuous traction. Transverse fracture, under general anesthesia, limb immobilization in Thomas splint with skin or skeletal traction.
Surgery. Intramedullary nail and plate and screw.
Fracture femur middle third, transverse fracture, under general anesthesia, traction and counter traction is used only to maintain the reduction.
It's successfully treated by conservatively. It is corrected by applying a local bulbar bronze splint. Mobilization before amputation and partial weight bearing. Union 12 week. Full weight bearing.
Surgery includes NTRA medullary mailing, transverse fracture, plate and screw, oblique fracture.
Fracture of femur lower end. It difficult to maintain in reduced position. Gastrocnemius muscle pull the distal fragment posteriorly. Skeletal traction by bulbar bronze splint. Forward angulation can be corrected by an upward pull by another strain man's pin passed through the distal fragment.
Surgery: angled blade plate and comminuted fracture, open wound, external fixation.
Complications. Malunion, shortening of the leg, stiffness of the leg and non-union. Okay students, thank you all. See you tomorrow with an interesting topic.